I'm so excited to be talking to you today. So this is Lauren Reyes. We're going to talk today to wrap up a series of interviews I've been doing this month with lactation consultants because it is National Breastfeeding Month, the month of August. So Lauren, you kind of know what I plan to ask you about today, but I'm going to ambush you a little bit here with the long introduction because I think it's really important for the sake of putting this conversation into context. So Lauren is a mom to many, right? How many children do you have at home?
I have 7 children at home,
Okay.
from age 4 to age 19.
Okay. 7 children at home, but you also birthed Breastfeeding Success alongside her co-founder and bestie, Janet Jones. And together, they support and nurture a ever-growing team of lactation consultants, teachers, office managers, billing team, many people. Lauren is a lactation consultant herself, an IBCLC, and Lauren's official title at Breastfeeding Success is Co-CEO and Chief Innovation Officer. So I've known Lauren for a few years now, and I can definitely say that innovation officer fits. Lauren is the queen of big thoughts, big ideas. She says yes very enthusiastically to almost everything. And I imagine that is in big part how the small little consulting business that you started originally with Janet has grown into what it is. Breastfeeding Success provides lactation consultants on staff at many hospitals. They're there to support families who have just had their babies, but also to train other medical care providers in lactation. They have 3 and soon to be more outpatient clinics and a growing parent education department. They have an internship program to help aspiring lactation consultants learn the field, train while working and earning income and getting mentorship from senior staff. You're providing a career path here. So all of this is a lot. And I think it takes a special kind of person with a very special kind of motivation to get here. So you definitely have a special kind of motivation, a passion, a mission. So I asked you to meet with me to wrap up National Breastfeeding Month, and I've been doing these interviews going along with different blog posts on different topics that are important in the lactation field. But rather than choose a topic for us, I asked you what you most would like to talk about. And you very quickly fired back, creating equity in the lactation field. So I think those were even your exact words because I wrote them down. So why did you choose this topic? Why is it important?
Thank you so much, Allie, for that beautiful introduction. It's an honor to be able to do this work and to be able to have the time to think about how we create equity in the lactation field. And it's for the clients that we serve, the families that we serve, but also for ourselves. And the mission of Breastfeeding Success, since we started 9 years ago, has changed and evolved to incorporate how we view equity. At first, it was being able to provide lactation services to families as part of their health insurance plan, or health insurance benefits, as it were, after they leave the hospital. This was our mission, our vision. We thought families shouldn't have to pay out of pocket. The Affordable Care Act told us and mandated that preventative health care is important, that lactation services and equipment are important. And of course, we're biased, but we agree that it makes perfect sense that we would be investing as a nation in healthy outcomes for people and preventing them from getting sick, to keep the costs that we all have to collectively pay down, but also because it's the ethically correct thing to do. So when we heard about the Affordable Care Act and we learned that it's mandated that you get lactation services as part of your health insurance plan, it totally sparked something in us that we decided this is what we want to do. We don't want to have to pay people or have people pay us out of pocket to get this service. So we were able to meet that goal within the first couple of years of starting Breastfeeding Success. We we work diligently to get in network with several of the major, we call them payers, but the health insurance companies, and to really advocate for them adhering to the law, which states that they must provide this care. And then shortly thereafter, even though it was always simmering in the background, we realized, okay, well, we've created equity for the patients, for the families, but what about equity for ourselves? Who are we training? How are we doing that? How do people enter the field of lactation? Do they have to pay out of pocket for this? Does this create inequity because some people can afford to pay to do their internship and some people can't? And just to give you a little bit of background, there are several ways that you can deliver lactation care. And myself and my business partner, Janet, and many of the people that we work with started out as WIC breastfeeding peer counselors. And WIC is a really awesome program. It's called Women, Infants, and Children, and it's a federally funded nutrition supplemental program. So it provides high quality foods for families with that are pregnant or have children up to age 5, as well as lactation support. And they also provide formula, which is needed in some cases. But what's fabulous is that they take a portion of the federal funding, excuse me, and they invest that in breastfeeding support. But the really cool part about it is that they take their own constituents. So they take their own participants, which you have to be low income to participate in this program, and they actually create a paraprofessional role within their government organization to teach people how to provide peer support from a breastfeeding perspective. And this can often lead to having a professional role in the field. So that's one way that you can deliver lactation care, and it is, in point of fact, if you use it that way, a paid internship, because often, like I said, people use it as a stepping stone to get to a professional role in lactation. And then there are other certifications that have, or there are a variety of certifications that have different requirements in terms of clinical hours versus didactic or just, book learning, as it were. And we've done an exhaustive search of all of these and are very familiar and agree that the IBCLC credential, which is International Board Certified Lactation Consultant, is really the gold standard for clinical care. And that is because it is the only credential that requires clinical lactation training. So you actually have to be in the space of a family, whether that's virtual or in person. Predominantly it's in person with another provider that is certified to get that hands-on experience with how to deliver this care. And it is many hours. For most people, on average, it's about 500 hours. So to become a lactation consultant, not only do you have to have an associate's level of health education, and then you also have to do these 500 on average clinical hours. So that's really a big order for many people. How do you get these hours? How do you, take all of these classes and make that fit in to your lifestyle and to what your family needs are, et cetera? And what we learned from our own experience, but also from the experience of people around us that were wanting to then come and work with Breastfeeding Success is, well, I'm ready, but I can't take 500 hours of my time and just donate them to this cause. I have to be able to pay my bills. And we had the realization that, okay, this was provided for us. And while we're a small little company and we operate with a very tight budget, it's also really important to us that we put our money where our mouth is. And if we say that it's important to diversify the field and to create equity, then we ourselves need to do that, because no one else is going to step in and do that. So we do have some really, it seems like you want to, I can go on.
I want to say something, because before you move on too far,
Yeah.
So when you say you have personal experience, you as a pregnant woman, as a new mom, and also as an aspiring lactation consultant, you had your own struggles. Is that right? Is that
Yeah.
what you mean by personal experience?
Yeah, certainly. So I was a WIC participant, and that means that I believe it's that you live on income that is at 185, I believe, percent of the federal poverty line. So it means you have very low income. I was a young mom. I was a woodworker when I first became a mom, and I decided I didn't want to be in a wood shop. I wanted to be with my baby, and I wanted to be helping people. So that really, I took a pause, of course, from working for a few months, and I really thought about it and found my way to, excuse me, to the WIC program and to becoming a breastfeeding peer counselor. And again, you have to be income eligible, and then also you have to have breastfed your own child to become a WIC breastfeeding peer counselor. So yes, I do. And my business partner, Janet, also, we met as WIC breastfeeding peer counselors. So it's a really great way to get into the field. But of course, there are those two stipulations. So for people that weren't on WIC, or maybe have not had a baby, or are just above that income threshold, it can be prohibitive for them to find a way to get that clinical experience.
So you were saying you were still small, but you were trying to think of a way to help people get into the field.
Mm-hmm.
Okay. So what's
Yeah.
next?
So we were thinking about that, and we took on our first student, as it were, our first lactation intern, and her idea was that, how am I going to get this done and be able to, provide for my family? And luckily, she had good family support, but we realized that there are people that are not going to be able to do this, so this is just not fair. And around that time, we took on a large contract. So we went from 2 people and like one other contractor to 27 people overnight, and started delivering care inpatient. So as our mission changed, and we realized, okay, we're not just delivering outpatient care. We're actually delivering inpatient care, and the need is there as well. So in the hospital, right after the baby's born, when you see the lactation consultant, if you're in any of the hospitals we serve, which are at this point now 11, that will be a breastfeeding success lactation consultant that comes to see you in the hospital. And, kind of shifting our view of equity, not just from outpatient care, but also to inpatient care, and thinking about all of the dynamics of who gets seen, who doesn't get seen, who's making informed decisions versus needing more information to make informed decisions. That really totally opened up our minds to equity in even broader context, because now we're working with 27 providers across, at the time it was 6 hospitals, and it really accelerated our thought process about creating equity in the field of lactation, and we had more clinical sites to be able to place people in. So we worked collaboratively with the hospital that or the hospital system that we were and still are in network or in partnership with at the time, and let them know our idea of bringing in students, having them, of course, paired with a lactation consultant, and allowing them to observe and then participate in care in a very controlled way. And they were all about it. They're a teaching facility. They were like, of course, this is how we train our nurses. This is how, we have the next generation of providers coming through. So what I can say is that this is really not done in across the country. There are very little pockets where you can find these opportunities, and they are certainly not paid. So then we, of course, went back to the drawing board and said, how can we provide, a living wage to people so that they can, get access to all of these clinical environments that we have, which is outpatient, inpatient, neonatal intensive care unit. We even have a pediatric cardiac unit that we deliver care on, and the list goes on and on. So we couldn't let that opportunity go by without really thinking about it in this broad context of who is going to get entree, as it were, to this. And of course, nurses are a natural fit, but then breastfeeding peer counselors, people that, we have somebody that it was a kinesiologist. I mean, we have really a really fantastic array of healthcare professionals that became involved, and then some people that were from totally different industries that, of course, took the health science courses and know about medical terminology, pharmacology, you know, all of these things, but really needed that hands-on experience. And we've been able to accommodate all of them with paid internships. So it's really great. So far, we've had 7 people become IBCLCs through this, and we have another now 9. We have 2 that started this week, so 9. We call them lactation techs, and it's really been quite successful.
Yeah, and I've talked to a couple of your lactation consultants who have come through that program. One of them in particular, you know, said, I didn't even know this could be my career. You know, I was a peer counselor at WIC, and I knew it was something that I just felt passionate about. I wanted to give back. But then, you know, my eyes were opened, and that this could be a whole career. And when you're increasing the equity in the lactation field for the professionals, right, for people coming up as professionals, you're also helping just in the general population, the people who are receiving the care, because you now have a more diverse staff, people who are more relatable to certain of your clients, and so they're getting better care, more equitable care. So it trickles all through everything that you do, because of, I mean, partly because of this program, and that's really what in National Breastfeeding Month is all about, right? Every week is focused on a different community that needs a special kind of care. You know, the Pacific Islander and Hawaiian, Indigenous, Black Breastfeeding Week. Next week is Hispanic, right? And so, you know, you and I can relate there probably best. And but we know that every community has a special set of circumstances, a special set of needs, and so it's going to make a difference, the quality of the care that they receive, that the providers
have a shared lived experience, certainly, and that's why we prioritize really working with IBCLCs that have diverse backgrounds, and not just the diversity, like ethnic diversity and socioeconomic diversity, but also diversity in their shared lived experience with others. So it can be that, like myself, people that were low income, people that like to surf. I mean, we can go far. People that have no kids, people that have kids, people that are have neurodivergence, people that certainly have mixed families. That the list goes on. And I think one thing that is really fantastic about our industry is that we start with validation with every patient contact that we have. It's like, hey, we're both here, we're both human, we're mammals. We can at least start there. You know, tell me about your experience. I want to know about it. And if we start from there, we get far, but it's even more if you have a shared, you know, lived experience. Like, for example, I'm from New York City. I really relate really well to other New Yorkers. They can be any ethnic background. That's like not to me that important, but if we have that shared experience, I can find connection points there because of just the way that we communicate. You know, that makes me feel at ease. And I know for Janet, who's my business partner, who's from Texas, she really feels that way with other southern people. They have a very, you know, nice way of starting conversations, and so sometimes it comes down to even that. But yeah, thanks for saying that. And I did want to add a little bit more when, you know, I really liked what you said about I didn't know that this could be a career. So creating equity, you know, is not just about having, you know, a diverse background of all of our providers and giving opportunities for them to have these internships to be able to become a professional in the field. but it's also creating a career trajectory that they can see themselves retiring from. And that's another really core tenet of what we do at Breastfeeding Success. We do not believe that professional lactation services should be part of the gig economy. We believe that this should be a job that if you want to have benefits and competitive pay, that you can get access to that. On par with what any hospital would pay you, and that level of benefits that hospitals can provide. And we pride ourselves on having a full suite of benefits. And then not only that, but having a career ladder so people can see themselves becoming, specialized in neonatal intensive care unit settings or outpatient settings, or working in physicians' offices, which we also do, to becoming a team lead and really helping drive clinical practice guidelines and standards, and doing rounding on other providers, and working more with administrative staff, to then becoming into a more managerial role over multiple departments, and then even onto an executive role within the company. Or if they're interested in going more of a route of clinical practice, really elevating themselves to being in the most acute care settings, and having the investment, which we make an investment in everyone on the team, whether they're an administrative assistant or an IBCLC or a registered dietitian or our medical director. Everybody has a budget every year, and you too, Ali, for parent education and being a certified parent educator. And I'm sorry I butchered that. Okay. Everybody gets access to this investment, this money that they can use for whatever they want every year to continue their education. So it is, equal, very competitive pay and benefits, investment in professional development, fantastic opportunities to grow within the company, because we are now from Dallas all the way, down to Kyle. So we have opportunities really now. Soon it'll be across the entire state of Texas. And then, of course, to even do research, and it makes me excited, because that's also equity. And that's saying that we're important, we're valuable, and our jobs are not dispensable. And we are not going to be furloughed during a pandemic or when there are budgetary constraints, because that doesn't happen at Breastfeeding Success. So that's also part of the equity. Thank you.
And I've watched it. I came on during the pandemic, so I can definitely back you up there. And like you said, there's so many different paths that people can take when they come to work here. I mean, so many of your lactation consultants now work in my department teaching, because they've been asking, I really like the idea of teaching. Can I teach? So there's definitely ways to branch out, and it never gets boring. They definitely say that too. And I've been interviewing them, like, it just never gets boring. And that's a lot to say for a career. I don't think all that many people can say that. Future plans, future goals. Do you have some things, because you are the Chief Innovation Officer and the big idea lady? So what's on your mind for the future?
Yeah, so as far as creating equity in the field, again, asserting to hospitals and to the medical establishment, as it were, that lactation is a specialty. We're not just there to be support staff for nurses, and that might not be the best solution for hospitals that are seeking to have ongoing, high quality, well-staffed lactation departments. That we're seeing across the country, that lactation departments are often downsized or furloughed, like I was saying earlier, when there's any major budgetary issue, or, for example, the pandemic. So number one, asserting us as the professional, the clinical professional for lactation clinic, or the gold standard professional for clinical lactation care, but also working with other states and companies to let them know that the investment that you make in having a paid internship for your IBCLCs will pay itself back almost immediately, because then you have that embedded pipeline. And what we're seeing is that there are many, many hospitals and just private practices across the country looking for IBCLCs and not able to find them because we haven't done this essential piece, which is ensure that we have a pipeline to deliver those people to their professional role. So we would love to share any of our, pain points, best practices, things that we've learned about how to create a paid internship for your incoming IBCLCs that pays for itself. So that is number one. We've proved it. It can be done. It should be done everywhere where lactation services are being, established. And then also, really thinking about, and this is again very kind of pie in the sky, but we also believe, because we were breastfeeding peer counselors and we did have access to funding to take the exam, to get they call them CERPs, which are our continuing education units, that maintaining that for every WIC department, that the breastfeeding peer counselor would then be able to have access to funding to actually become an IBCLC is key. And then, of course, also supporting other credentials that may not have that clinical component, but they're absolutely needed, in various settings. We can even see ourselves having, intern, and we do often have interns that have a credential that is that doesn't prepare them clinically for the care, but gosh, they are very well prepared from a didactic or book learning perspective, and we value that. And then ultimately, the biggest thing, and for me, I'm really happy that I'm freed up and really able to basically scream this from the rooftops, is licensure. That we need licensure in every single state in the country. And for me, that would be, it could be a tiered licensure where every lactation provider is included in that, just like we do with nurses. But from my perspective, the more that we establish ourselves in the same way that other specialist providers that used to be allied health providers, which we currently are, such as physical therapists, occupational therapists, speech language pathologists, the list, registered dietitians, the list goes on and on. If we follow the trajectory that they themselves have followed and use their best practices and learn the process that they went through, all of them, to be licensed healthcare providers, then we will have won. And we will have truly created equity in our field. So that is my mission. That is what I work on. I spend a portion of every single day thinking about this and thinking how I can, contribute to this. Then we wouldn't be so just, biting our nails about the Affordable Care Act. Like, what happens if that is undermined? Because we would have a license and we would be a player at the table. So all big things, and of course, very, very niche information. So I hope if anybody listening contacts me, I am absolutely available to you for any questions that you might have or any feedback and collaboration, because it's all in the spirit of collaboration and we're not like gatekeeping any of this information.
Thank you, Lauren. I think it's a great way to wrap this up because it is a time to think about these things. That's what National Breastfeeding Month is to talk about, think about, and bring all this to the attention of everybody, not just the people receiving lactation care, but the people who will be providing it, or bringing up people who will be providing it, or licensing people who would be providing it. So very important stuff. Thank you so much for being here. And I appreciate you so much. It is so great working with you, working in this company. It is definitely the most fun I've ever had. So I can speak from experience.
That warms my heart, and we really are what we are because of you, Allie, and because of everybody on our team. Like, that is, without you guys, we're not anything. So we're here to serve. Thank you.
Okay.